Hi, my name is Autumn. I will be the nurse for today. And just to make an announcement for the camera person, they're doing alarms periodically in the library. It's not about to close. Okay, continue. So I will be your nurse for today, and I will be doing an indwelling catheter on you. I'm just doing hand hygiene. Can I have your name and date of birth? Okay, perfect. I'm just gonna scan your wristband. Okay, and I'm also going to come over here, making sure that this is all intact. This is a 14 French, which is correct for my patient. And I don't see any tears or anything. It is not expired. So this is all good to be used. And do you have any allergies? No? Okay, great. And you already signed the public exam consent form, correct? Okay, great. And the nurse assistant, she also told me that you got perinatal care already. So that's wonderful. And we can start the procedure now. And is it okay if I palpate your bladder? Okay, thank you. Okay, feels good. I'm just gonna put you in dorsal recumbent position, and you're already in that position, so that's great. I'm also going to inspect the meatus. Meatus looks good. Okay, I'm just doing hand hygiene, and now I'm about to put on some sterile gloves. That's what is going to make it all done. To put my trash. Okay, so I'm first opening this away from me. Then to the side, I'm only touching the 1-inch border. Then to the other side. And finally, away from me. Just adjusting it here. Okay, now I have the blue fenestrated drape. I'm just going to put the shiny side down, like so. Now I have my sterile gloves. I'm only touching the inside of the glove as I put on the first one. And I'm keeping my hand up. Okay, perfect. Now I'm going under for the second glove. Okay. Only touching the outside. Okay, so perfect. Now I'm taking this white drape. I'm only touching the 1-inch border. Okay. I'm just putting this hydrogen peroxide all over. Keeping these on my sterile field. And now I'm just putting some lube. Putting lube at the corner. Okay, so I'm putting lube at the corner. Perfect. Now I am taking my sterile water, pushing out just all the air out of it, so it's all good. And I'm just attaching this to my catheter here. Now I'm taking off this off of my catheter, and I am just putting this in the lube. Leaving it like so. Disposing of that. Now I can put this here and bring this over to my patient. Okay, so I'm going to stand on this side actually, since I'm right-handed. And I'm going to just expose the meatus like so, keeping my hand like this. So now I am doing down, down, down the middle. Okay, perfect. So now I can move this. Okay, so I still have it exposed like this. Now I am inserting my catheter. I'm inserting it until I see urine, and I see urine. So I'm just going to advance it another 2 to 4 inches, making sure not to touch anything with my fingers. Okay, so now I see it is in, so I'm just going to hold it with my non-dominant hand, and I'm going to push 10 milliliters of water slowly. Okay, so now that that is in, I can take this off. And now that it's secure, I'm just giving it a slight tug, and I'm just giving it a tug to make sure that it is in the urethra, which it is, so that is all good. And I'm going to just take this, I'm securing it to the patient's thigh, the anterior thigh, and securing that to the anterior thigh. That's all in place. I'm going to now doff my gloves. Performing hand hygiene. Now I'm going to put this on the bedside. Okay. Now, patient, did you feel any pain? Nope, you're all good. You were comfortable. Okay, wonderful. And you tolerated it well? Okay, great. So now I'm just going to document in the patient's EHR of how they took the procedure, the amount of mLs, the type of catheter, which is a 14 French, the color, clarity, and amount of urine, the date and time of doing this procedure, and just how they tolerated it overall. And that will all be charted. And I'm also going to let the patient know that peritoneal care will be done every 8 hours for this. And I believe that should be it. Yep. Thank you.